All right, good morning, everyone. Thank you for joining us. We are waiting for our attendees to trickle in, but we're going to go ahead and get started. I want to welcome you all to our third town hall on race and COVID-19 community-based organizations. My name is Frances Lobos. I use she, her pronouns, and I'm a co-chair for the Diversity and Equity Council.
Hi everyone, good morning, happy Friday. Thank you all for joining us today. My name is Brenda Nunez. My pronouns are she, her, and hers, and I work with Star Vista. I'm here today as the other co-chair for our Diversity and Equity Council. Now, before we get started, we really wanted to very briefly say thank you and acknowledge the planning committee for this event. Thank you so much to our Behavioral Health and Recovery Services, Get Healthy San Mateo, Bay Area Community Health Advisory Council, and Star Vista. And then very quickly want to let everyone know that this event will be recorded today. We also have Spanish interpretation services available for this event.
Wonderful, thank you, Brenda. So now we're going to get started with our interpretation services. I would like everyone to go ahead and locate the globe icon on the bottom of their screen. And please choose your language of preference. Even if you are an English speaker, please choose English. And then Brenda, if you can hit enter one more time. Thank you. And for those of you joining us over the phone, you can select on the smartphone the More button in order to switch languages. And also a reminder for everyone to please, including ourselves, the speakers today, to please speak clearly and slowly and be mindful of any acronyms so that our interpreters can capture the information. So the instructions are also on chat. Thank you so much, Christy. And I believe the interpretation is now enabled. So please make sure that you choose your language. Thank you. And again, as Brenda mentioned, this event is being recorded and will be posted on our webpage at the end of the event.
Thank you. And just very briefly, a few housekeeping items before we get started. All participants will be muted upon entering the event. You will get a chance to speak during our community feedback. During this time, if you wish to speak, please use the raise hand option to speak. And then if you are joining us on the phone, please use the thumbs up option so that we know that you want to speak and contribute to the conversation. We also want to be mindful of time, so let's try to keep it 2 minutes max for each participant. And the last thing that I want to mention here is that all presentation slides and the resources will be sent out in a follow-up email after the event. Alrighty. Now I'd like to hand it over to Dr. Maria Lorente Forcenti. Sorry about that. With the Office of Diversity and Equity.
Good morning. We'd like to start our meeting today by honoring Ray Mills, Executive Director of Voices of Recovery. Ray passed last weekend, and I believe I am with thousands in and outside of San Mateo County when I say that he will be missed dearly, and that his impact in our lives and communities will always be remembered. Ray was an amazing person who gave his heart to helping others during their most challenging times. From all of us here, we send our love and support to the Voices of Recovery team and all of those who are grieving this tremendous loss. At this time, we'd like to take a moment of silence. So thank you. Next slide. So our goal today is to obtain and share your voice and recommendations to support our COVID-19 recovery work. You can review our agenda here on the slide. From our first community town hall, we've been working with community partners and our workforce to understand the impact of COVID-19 and race and create informed priorities. We hope to expand and ensure the priorities are current with this dialogue from our valued community-based organizations and San Mateo County leaders. During the last two town halls, we were fortunate to learn more about what San Mateo County is doing. Shared with us the work that was being done on our long-term strategic plan and coordination that was happening, and how our leaders were working to support all of us and hear all of our voices in these efforts. Peggy Jensen and Danielle Lee will be Danfield Mullen, management analyst with the County of San Mateo, who will share with us current county efforts.
Great, thank you, Maria. Let me pull up our presentation. And can everybody see the slides?
Not yet.
Not yet, okay. Is this better?
Perfect.
Yes, thank you.
Sorry, great. Sorry about that. Thank you so much for your patience. Thank you to everyone for having the opportunity to present on our San Mateo County Recovery Initiative. The initiative is a collaboration among local government agencies, community-based organizations, nonprofits, private partners, and residents to build a more equitable, healthy, and connected San Mateo County by creating a better future through collaboration, advancing equity and inclusion. And to start off the presentation, we wanted to provide you with an overview of the project and how we were able to work with our community partners to develop the strategic plan and then identify resources and next steps to implement the strategies that were identified by the community. So through the Recovery Initiative, we've really looked at 4 key areas, looking at strategies and recommendations to address public health, and in particular, how do we reduce the spread of COVID, and then also identify ways to get resources to our throughout the community, particularly to residents who are experiencing a great impact by the COVID-19 virus. The second area is looking at equity. How can we advance equity and really make sure our programs and policies are helping those in the greatest need? Looking at fiscal responsibility. How do we leverage the dollars that the county has in addition with other potential funds for either through philanthropies, partnering with other jurisdictions and cities to be able to implement some of the strategies throughout the county. And then looking at countywide collaboration. How do we work with all of our community partners on the recommendations and next steps? Through this initiative, we've worked with almost 170 different community partners, ranging from local government agencies, private sector partners, and community-based organizations. At the heart of our recovery initiative is really looking at how can we advance equity. We know that the effects of COVID-19 are amplifying the inequities, and we see the recovery as an opportunity to do a collective restart to create a more equitable community, systems and policies and practices going forward. And by doing that, what we did through the recovery initiative is establish an equity recovery group that had representatives from community partners throughout the county, who also sat on a number of our committees who helped identify recommendations and strategies to really address sort of key challenges that the recovery initiative looks at. From the recovery group put together an equity statement, which you see before us, as well as a series of questions that each of the committees could use to help vet some of the recommendations and programs that were being developed. And those questions really look at decision-making and solutions, sort of identifying who is sitting at the table, whose voices are being heard in the decision-making process. Second area is really looking at the data and trying to understand what the data is telling us. Do we need to pivot our programs in response based on the data that we are reviewing on an ongoing basis. The third area is the burdens and benefits. Are people being impacted or burdened in a certain way through the programs or recommendations being implemented? Are other communities seeing benefits while other communities are not? And then the fourth area is accountability, communication, and community engagement. How are we reporting out our success? How are we engaging our community members on an ongoing basis? We know that the Recovery Initiative, it needs to be flexible. It's sort of a living document. And as we go through the different transitions and phases of the COVID-19 pandemic, we know that we will need to continue to revise and rethink our strategies and recommendations. And by doing that, we need to really engage and communicate out the work that we're doing and the progress that we're seeing, or the areas in which we're not seeing enough progress. So when we first looked at the Recovery Initiative, we really wanted to understand where the need was within the county. We know that 65% of COVID-19 cases are residents of color or ethnic minorities. Additionally, we have over 10,000 immigrants who have been able to receive $1,000 in financial assistance through our Immigrant Assistance Program. We also know that a lot of our community members have an increased need in food, and Second Harvest has seen a 250% increase in food distribution during this pandemic. We know that a number of our small businesses have been severely impacted by the COVID-19 pandemic, so working with our small businesses to be able to provide assistance to them during this time. We know that our students and children are having to do distance learning, but in order to do that, they really need to have Wi-Fi and technology tools to succeed. And we know that over 4,400 students really lack those tools to be able to thrive in a virtual learning environment. And we also know that we have 20,000 low-income workers who have lost their job during this pandemic. So sort of looking at the data and looking at the need, the Recovery Initiative sort of focused on 9 key areas. The first of which really looking at our basic food, housing needs, making sure that we could provide services and resources within that area. Also looking at public and active transportation, sort of identifying strategies and looking at recommendations to be able to provide access to public transportation or active transportation in a safe manner. Also looking at childcare, we know we have a number of our childcare businesses that have not been able to stay open during this time, and we also know we have families in need of childcare to be able to return to work. Looking at providing workforce development and business and nonprofit support. And then lastly, looking at that digital divide and what it means not only for our students and our residents and our community members, but also sort of what it means for our businesses as we sort of work within this virtual reality. And then lastly, looking at the out-of-school care, sort of being able to provide options for students and families in need of assistance during this pandemic. Oh, sorry, and I'll just say, surrounding all of this is really looking at how are we reducing the spread of COVID-19. So making sure that there's support and testing, as well as resources and communication around how to reduce the spread, and making sure residents have resources needed during this time. So for a path to recovery, really kind of looking at 3 areas to be able to funnel our recommendations to meet the needs within our community. The first of which is sort of really addressing that critical immediate needs. We know that not only has the county, but a lot of our local jurisdictions and our community partners have stood up programs during the first 9 or 10 months of this pandemic to really address those critical needs within our community. We also know that going forward, we need to make sure that we are creating community capacity so that our businesses, nonprofits, schools, the healthcare system really has the capacity to serve the community and meet their needs, as well as develop consumer confidence when we are in a position to sort of open up safely, sort of helping our residents feel confident in making those choices going back. And then also looking at how do we build a better future, knowing that this is an opportunity for a collective restart, sort of putting putting in place policies and programs to help us move forward in an equitable way. So when we think about the COVID-19 pandemic and our response, we sort of have kind of 4 areas that we've looked at within our community. The first of which is we know that we had a lot of inequities and issues during pre-COVID. In terms of public health and preparedness, we know we had some health disparities. With housing, it was expensive and limited options. That is the same for childcare. There weren't a whole lot of options available, it was expensive for families to be able to attain childcare. Connectivity, we know that we had a digital divide within the county. Not everybody has access to Wi-Fi or the internet, as well as technology, or knowing how to use that technology to be able to thrive. And then for the economy, we know we had a low unemployment. However, there were a lot of gaps for small businesses as well as our workforce. And some of our workforce had to work 2 or 3 jobs to be able to afford the sort of high quality of life that we have here in San Mateo County. So during this pandemic, we know that kind of going forward, we sort of have 3 phases for the recovery. The first of which is sort of the initial response. We know that we've been able to set up some sort of short-term responses to be able to address some of these critical needs. Looking at how do we shelter in place, identifying resources for rental assistance and eviction protection for those looking at housing. Providing local grants and federal loans for childcare, for connectivity, working with our community partners, our libraries, and our school systems to be able to provide hotspots and laptops to students as well as community members and residents. And then for the economy, providing local grants and federal loans to our small businesses, but also looking at ways that we can sort of try to identify workforce programs to help folks who are in need of jobs going forward. And what we see is we know that this response is going to sort of transition through the pandemic. We know that we are going to have other issues sort of arise and emerge that we'll probably need to continue to put in short-term programs. But as we transition through the phases of the pandemic, is sort of how do we go from that initial response to sort of the midterm recovery and identifying what those solutions could be. So those range from making sure that families have support and for individuals who have contacted COVID-19, making sure that they have resources for to be able to isolate in a safe and healthy way, making sure that we are doing the mental health outreach and resources for community members within San Mateo County. For housing, looking at rent and lease negotiations, continuing to provide rental assistance and eviction protections going forward. For childcare, helping our childcare providers with technical and other assistance, making sure that they have the resources to be able to open back up in a safe and healthy manner. For connectivity, looking at ways in which we can expand Wi-Fi to all of our community members during this time. And for the economy, really looking at providing business support, job training, as well as other support. And then long-term, sort of how do we provide some strategies and solutions so that when we come out of the pandemic, we're really in a better place where people can thrive and excel going forward. So for that, for the COVID-19 response, really looking at making sure that we are opening in a healthy manner and that we do have greater health equity throughout the county. For housing, working with our jurisdictions and identifying what are the potential funding resources that can be leveraged to provide more affordable housing at all income levels and for all ages within our county. For childcare, making sure that we are providing quality, affordable childcare, expanding out that childcare network. In terms of connectivity, identifying quality internet for all residents. And then lastly, for the economy, making sure that we do have a robust economy with low unemployment, but additionally also making sure that we have meaningful jobs. So kind of going forward, how do we implement these recommendations and track progress and engage our community? So we know here for the county, we really need, our implementation is really dependent on working with our community partners to identify what those, how to identify strategies to really implement the recommendations in a meaningful way. And then also, how do we track progress to make sure that we are having the intended impact and providing the resources and services going forward. And then also, if we need to readjust our strategies or recommendations, how do we do that in a timely manner so that we can get resources out to community members in a meaningful way. So through the Recovery Initiative, we're working with a wide variety of community partners on a number, on all of the different focus areas. Really working with our San Mateo County Health Department around the public and mental health resources for basic needs, working with our Human Services Agency, our core services agencies, as well as Second Harvest to be able to provide housing and food, as well as financial assistance for our residents during this time. For the economic recovery, really working with SAMCETA to sort of work with our large and small businesses, the Chambers of Commerce, working with the Thrive Alliance to sort of partner on our nonprofit support, and then working with Job Train, NOVA, and which is our local workforce investment board, and the San Mateo County Central Labor Council to really identify strategies to bring in meaningful jobs for our workers during this time. For the digital divide, San Mateo County Office of Education and the county's Information Services Department have launched a pilot program in 8 school districts to really identify resources and provide Wi-Fi through hotspots or other Wi-Fi resources and technology, as well as hardware in terms of computers and technology for our students. Also for childcare and out-of-school care, working with First 5 and the 4 Cs to really help our childcare providers and out-of-school care providers be able to open in a safe and healthy way. And then looking at transportation, really partnering with Samtrans on how to move forward in a healthy way. So in terms of tracking our progress, we do have indicators to sort of identify if the recovery initiative is having the intended impact and really helping the community members in need. For our basic health, our basic needs in terms of housing and health, we know that we have 23,000 extremely low income renters within the county. Also looking at, we've had over 4,000 requests for emergency financial assistance. And as I mentioned, we've seen 250% increase in the need for food provided by Second Harvest. For our digital divide, as we mentioned before, we have over 26,000 households without Wi-Fi access. So how do we help those households be able to connect going forward? And then we also have over 4,400 children that don't have access to Wi-Fi or technology hardware.
Wi-Fi o tecnología.
Request financial aid assistance to be able to provide a safe and healthy childcare for our families. And then lastly, for the economy, we know that we've had over 20,000 low-income wage jobs lost. Our unemployment rate is over 7%, and we have over 216 small businesses have closed during this time. So in able to track progress, we did build a website at smcrecovery.org. You can sort of go through, it has dashboards for each of our focus areas, really looking at the economic indicators, as well as showing sort of how our programs and policies are helping our communities of the communities throughout the county, and particularly those in greater need. So for today's presentation, we really wanted to focus on the recommendations around vulnerable populations, which really look at how do we ensure the essential and basic needs of our community, and looking at particularly food and housing going forward. So in order to meet our essential needs of our vulnerable populations, really identifying sort of 7 key recommendations around housing and general support, providing that emergency rental assistance to qualified households, launching our pilot for an incentive program for renters and property owners to compromise on back rent, providing targeted financial assistance to small residential property owners, continuing to contract with our community-based organizations and nonprofits to provide legal support, public outreach, information, and referral services in regards to housing. Looking at ways we can reduce our overcrowding in COVID-19 hotspot areas. Also, looking at ways to increase the number of affordable housing units. And then lastly, continuing to assess our future assistance needs and working with the public, private, and other funders to sort of identify what those projected demands could be so that we can continue to provide assistance through the grant programs that have been stood up during this time. So for our current programs, we have over 16 million in rent assistance that is available to be distributed for our households. We did launch a pilot program of $2 million to help assist our small residential property owners. We know that those owners rely on the rent to help pay off the mortgages. So we did provide a pilot program or a pilot assistance program to property owners so that they'll be able to keep those properties open and keep our families housed. Providing $1 million to nonprofits to provide legal assistance, as well as information referral services for renters and property owners. And then providing over $12 million in emergency assistance grants for immigrants that receive $1,000 grant per household. In terms of providing food services for our vulnerable population, the county is going to continue to work with Second Harvest and our community partners to identify what that unmet food need is, particularly in geographically targeted low-income communities. We know that there's great need now, but we also anticipate a great need going forward. We will continue to collaborate with Second Harvest and our community partners around on the extent of the food need and their ability to meet that need, and see if other resources or additional funding needs to be provided to be able to distribute the food to our families and households throughout the county. Looking at expanding capacity of Second Harvest and other local organizations to provide assistance with groceries and meals if there is an increased need that arises. We know that we're going to go through a couple of phases during the pandemic, so really sort of being able to build out that capacity of Second Harvest to serve everybody within the community. And then looking at our meal and essential item delivery services and identifying options to be able to expand those programs to homebound vulnerable residents and those residents who need to isolate. For current programs in regards to food, we know that we have over 4 million pounds of food have been distributed per month by Second Harvest to our residents here in San Mateo County. The Great Plates program has provided over 770,000 meals to seniors throughout the county. And through our CARES funding, we've been able to provide $3 million to Second Harvest to be able to expand their services and provide food within our county. This is sort of an example of the dashboard that we've created to be able to track our progress and making where we're having the intended impact, and also sort of identifying areas of great need. You can go to smcrecovery.org. We've been able to build out dashboards for each of the 5 focus areas of the recovery initiative. And with that, if you have any questions, we would be happy to answer them about the work of the recovery initiative. As I said before, we know that the recovery initiative, will sort of be a living document. We're continuing to meet with our community partners throughout the implementation phase to sort of identify those recommendations and see if any changes need to be made.
Thank you, Jessica. Thank you so much for the presentation. I know it was difficult to see for some of our attendees today, so we will resend the link to the document so that you can look at the initiative report more closely after the event. Really quickly, because we want to get to our panel discussion, prior to the event, in preparation for today's event, we did send out a survey to all of you and community-based organizations to get feedback. And a lot of what you see in the center of the diagram are the needs that Jessica just spoke to. So the food insecurity and childcare access. So we're happy that to see the alignment. But in order to get more feedback today, we want to get started with our panel discussion. So I want to introduce now Shireen Malakibsali. She is the Services Manager for Public Health Policy and Planning to lead us in our panel discussion. So welcome, Shireen, and all of our panelists.
Thank you, Francis, and hello, everyone. It's great to be here with you today. My pronouns are she and her. We have an amazing panel of community-based organization leaders for you. They're going to be sharing their experiences of their organizations navigating COVID, the changes, the pressures, challenges. They'll also share the types of supports that they need to further help the communities they serve. And really, our community-based organizations are often a lifeline for our most impacted communities, and they have been on the front lines of providing support to our communities of color, our low-income communities, our LGBTQI plus youth, and more. And these are difficult times and must stretch their leadership and organizational capacity. And they, along with so many of you in the audience, have just found ways to show up for our community. So I'm really honored to begin our discussion by introducing the panel that you'll hear from in this order. You're going to hear from Lisa Teeler from the Bay Area Community Health Advisory Council, Stephanie Weisner from Star Vista, Kava Talua from One EPA, Kalima Salahuddin from Jefferson High School District, Frankie Sapp from the Pride Center, and Georgia Peterson from the Mental Health Association of San Mateo County from Spring Street Shelter. So I'm going to turn it quickly over to Lisa to please kick us off. Thank you, Lisa.
Thank you, Shireen, and good morning, everyone. Before I start, I just wanted to acknowledge the Planning Committee for organizing this great third town hall. My pronouns are she and hers. The Bay Area Community Health Advisory Council, or BACHAC for short, is a community-based organization focused on eliminating health disparities in diverse communities across generations. I've been the pleasure of being the director for the last 3 years. And then prior to that, I was in the biotech industry supporting clinical trials and manufacturing processes and inclusion, diversity, and equity. I also appreciate this opportunity to really share the experience that so many other CBOs have experienced. Basically, it's been several buckets. One, the financial bucket around having some of our funding cut. And as a result of that, there has been delay in being able to offer some of our programs, as well as staffing needs, not being able to hire individuals to help us do this work, a cut in salaries, as well as the other bucket of, because of those finances weren't available, we have some of our, we have a major event called Soul Stroll for Health that we originally had scheduled in May, that we had to postpone to October. In addition to that, because of COVID, we had to kind of spin on a dime and make that able to do a normal, in-person event. And that created some additional pressures and financial burdens on our organization. I also want to just pause there and say it is, as many as other organizations will probably allude to, this has been an impact on our community, our volunteers and our staffs, with job loss in their families, having to move out of the area, having to change industries as well. But still being resilient and innovative in terms of things that we were able to do. And of course, there was the hidden costs of being virtual, with acquiring Zoom and other platforms, engaging some social media professionals to help us communicate with our community, as well as our community having to spin on a dime as well and navigate online. Some of our programs had to been shut down. We have a community mammogram program, and because we're in partnership with the hospital, and because of COVID, we had to shut down that program for a number of months. Workload has definitely increased with the additional work that needs to be done around COVID. So that's another area that we found ourselves in this particular situation. On the other hand, it has created some great opportunities. It has allowed for us to work more closely with the county and other community-based organizations and community leaders through San Mateo County and throughout the Bay Area. We were able to launch a Wellness Where You Are series around various topics. So we did one on navigating the new world of work, nutritional programs, information about COVID and the impact on our community. We also did a special one with one of our members who's a data scientist that did a workshop on Data 101. And we've also had the opportunity to participate in the recovery initiative efforts that the county is organizing. So I was on the equity group as well as the vulnerable populations committee. So I appreciate that opportunity to be on there. And then we're very much involved with the COVID effort in addition to the recovery efforts. I'm on a number of task force around COVID research and some studies. We just launched our community COVID testing this weekend with Shireen and her colleagues, as well as Pastor Bussey from St. James, AME Zion Church, as well as the College of San Mateo nursing program. So there have been some great opportunities out of the midst of this tragedy. And again, would acknowledge the many, many souls that we've lost this past 8 months. In terms of support, we definitely could use some capacity building funds to help us build some of our infrastructure that we lost and we'd like to gain back as well as additional. We know that we're going to be in this virtual space for a long time, and so that has needs. Being able to hire some more social media professionals to help us with our messaging. I think also streamlining processes when it comes to grants and other ways of securing funds. Involvement early on initiatives from design through implementation and evaluation would be critical. I just want to put a plug in for when the vaccines are available, that the community and the community-based organizations are involved in that process. I would encourage others to continue to listen. A perfect example is the testing sites that we started. It took about 4 or 5 months with constant conversations with a number of folks to eventually get that on board. And I'm hoping that we can cut down that time frame when we have other initiatives and programs we're rolling out. Also, the social justice impact. Black Lives Matters. We've seen a lot of resolutions, marching, listening circles, all that's important. And we need to make sure that we have tangible action plans around that with equity embedded into policies and business practices. And that is critical. We seen the social and the racial divide in this country, and I'm hoping that we can start on a path of healing, and more importantly, healing on several different levels, in addition to helping our communities be healthier during this time. I also want us to be more open to having leadership that actually reflects the communities that we serve. And I think another way of providing support is the data. Data is critical, particularly for community-based organizations. We need to know who is being served and who isn't. And so any way that we can get demographic data on various programs and initiatives will help us design our programs as well. There's a lot more, but I want to be sensitive to our time. And I appreciate the opportunity to talk about our needs, opportunities, and look forward to working with others.
Lisa, thank you so much. It's so impressive to think about all the increased workload, the learning, the resilience and innovation came through. So thank you so much for sharing and all the great work that you do. I'm going to now turn it over to Stephanie Weisner to hear from her.
Hi, thank you so much. My name is Stephanie Weisner. My pronouns are she, her, and Aya. and I'm the Chief Program Officer at Star Vista. It's really an honor to be here today, and really appreciate the work of the Planning Committee and all that made it to make this happen. I will do my best to speak slowly. Please remind me if I don't for the interpretation. If I get nervous, sometimes I speak quickly. So I'll share a little bit about Star Vista. We serve individuals, youth, adults, and families from prenatal all the way to older adults. So we really cover across the lifespan, and really appreciate the partnerships with the county and the other agencies that we've worked with, and this has really made the work that we do possible. So as many of you can relate to, when the pandemic first happened and shelter in place, really transitioning to remote work was a huge challenge for us. We wanted to make sure that we were still here for our clients. And we were able to do that relatively seamlessly. I'm so proud of our staff, people stepping in to be there. But there's so much training that was needed for staff and clients. And that is still ongoing, and learning how to do that and making sure that that we're able to access and reach people. We also have 24-hour facilities, and where we are having serving vulnerable populations, our homeless adults and our homeless youth. And so finding ways to ensure as quickly as possible with the little information we had that people were safe, and that we were able to protect people. So working really aggressively to get PPE, and so excited that testing is now more readily available for our residential programs and for our young people, particularly who really struggle with the shelter in place. One of our biggest ongoing challenges is staff morale, and knowing that our staff are experiencing so many similar things that our clients are experiencing, and trying our best to build connections and to support and be as flexible as possible. Really trying to explore childcare options, supporting families who are in crisis, that we're our staff who are in crisis and how to best meet their needs. Looking at wellness pay for some of our residential staff who are put at risk. And so, our staff are going above and beyond and trying to figure out how to support them, and so that they can support our clients. And one thing that we've wanted to do, as Lisa was sort of saying, in parallel, is really looking at diversity, equity, and inclusion with everything that has been brought to our attention and highlighted so much in the world, and how to do that alongside everything that's been happening, and have those kind of conversations in a remote way. Acknowledging that in some ways, the remote work has allowed more people to come together more easily, but also other challenges that it presents. And so we're continuing that process as an agency, and really having some important and challenging internal and external conversations around leadership and how we have these conversations. Funding, I will say, having to go virtual for fundraising is a big impact on our nonprofits. We just had an event that ended up being very successful, but we have also lost other opportunities. So figuring out how to navigate that. And we've had some grants shift. So there have been more opportunities for funding around COVID, which has been great, but other funding has dropped away, and trying to navigate that, as well as decrease in some fee-for-service. A lot of our clients are not able to access services, and so that decrease has really impacted us financially. And so we are continuing to navigate that, and trying to forecast and budget is always interesting in this time, as everyone knows. Oh, sorry, I'm over time. Quickly, our clients, the most important, that's why we're all here, navigating the digital divide and training everybody, and really trying to reduce barriers to services. So looking at reducing our fees, not having fees for clients, making sure that people who need to get seen are seen in whatever way that is. That's been huge. And really creatively trying to engage clients. So whether that's sending care packages to people, times when families would come together and share meals, sending gift cards. I'm really trying to engage isolated clients who don't have access to the internet or don't use that. And I know we'll go into more specific examples of that farther along. But our staff have been incredible. managing that and trying to have, flexible funding with our funders to change line items so that we're able to provide that support. A little bit of data that we have is important that of the clients we serve about 45,000 clients a year. 46% of them have reported that they've been impacted by COVID. And 69% of children 0 to 5 have reported an impact of COVID. And these are people who've, so it's, of the data that we have. So that's children are at a higher rate, but especially 0 to 5. And then for challenges accessing resources during this time, 42% of our clients that are primarily Spanish as their primary language have had trouble accessing resources. And this is not new information, but important data to have. And then we have a hotline, a 24/7 suicide prevention crisis hotline, and we've had a 25% increase in calls related to COVID. And so happy that we're able to be there, but also knowing that there's so many people that need more. So thank you so much for allowing my space, and look forward to hearing from the rest of the panel.
Thank you, Stephanie. Appreciate it. And I want to just lift up the work, the diversity, equity, and inclusion work that you mentioned, and Lisa did also around at the very same time that you're lifting up the changes for COVID, that you're taking on these additional efforts, which are critical and important for our discussion today. I'm going to turn it over to Kava from 1EPA.
Hi, everyone. Can y'all see me? Yes? No?
Yes, we can see you and love the background.
Thank you. Good afternoon, everyone. My name is Kava. My native Tongan language greeting, Malelele, or Male Taulava, translates to, I am grateful that you are well, and I'm grateful that we have made it to this moment. And I will also add Tawapalawa and Bulavinaka for 2 other major Native Hawaiian Pacific Islander languages spoken here in East Palo Alto. Now more than ever, we at One East Palo Alto, for which I have the honor of serving as its executive director, are full of gratitude for each moment we share as we continue to navigate this season of uncertainty. Okay, question 1. So with regards to OEPA's experience this year during the pandemic, I echo what both Lisa and Stephanie have spoken about. Here at One East Palo Alto, we've experienced very
I'm sorry to cut you off. I'm getting some feedback on the notes that it's hard to understand you, and I want to make sure people get a chance to really hear what you're saying. I wonder if you could maybe try moving slightly away from the microphone, and let's see if that'll do it a little bit. Try that. Try speaking. Oh, now we can't hear you at all.
Oh, no.
Okay.
I did this earlier too.
Okay, that's good. I think that's pretty clear. Let's see if the audience can hear you now.
Okay. Can y'all hear me better? Is that better?
People are saying it's a little bit better. Yeah.
Okay. All right. I have audio issues no matter what computer I'm on, so I'm not sure what it is, and I apologize. I tested this earlier, and so I'm very sorry to everybody.
It sounds great. It sounds good.
Okay, so where were we? Yes, I completely agree with Lisa and Stephanie. We are experiencing similar challenges here at One East Palo Alto. When the pandemic started, the first question we thought about was, how do we pivot all of our programs so that we can keep our staff? So we immediately pivoted all programs online, managed them remotely, and we even created an online summer youth employment program, which was an alternative to our traditional sponsored employment program, which is all in person. Of course, we always do our best to be innovative, but the pandemic and the social distancing protocols have allowed us to become even more creative in the way we serve our community. We also provided all staff with equipment to enable them to work from home, including laptops, providing monthly phone subsidies to our staff, and offered hotspots if needed. But what I would say is one of the main methods of outreach in vulnerable communities, communities of color, and especially here in EPA, our way of outreach to our community and engaging them is all in person. And so we really utilized our food distribution this year as a way to, for instance, get our material for census, voter education, COVID-19 safety guidelines, and so forth into our food distribution, into the school district's food distribution, and work with our partners to get the information out. We also utilized the city's COVID-19 testing site, which OEPA has supported since they started that in late spring. And I just heard this morning from the city that here our positivity rate in EPA has spiked this week, and that's just on top of already having a community that has, I believe it's triple the positivity rate for the rest of the county. So we're continuing to support that. As far as funding, OEPA sought out, and I'm sure as a lot of other CBOs did, we went out, we went after a lot of COVID-19 funding opportunities, and we received great support, which we are grateful for. And with that funding, we were able to sustain our staff and our programs throughout the year. And one thing we recognized too was our staff wellness and the well-being of our staff members. And in order for them to sustain and continue to serve our community, it was important to us, the leadership of OEPA, to make sure that they're well as well. Yes. So we've been providing staff with self-care hours on a weekly basis, provided a little bonus, not much, but it was something to let them know that we appreciate them over the summer. And then we also check in on their wellness on a weekly basis during our staff meetings. Question number 2. So this question was interesting because I couldn't answer this question on behalf of all the CBOs here in EPA. So I reached out to several of our community partners. And here's a theme. These are the main themes that I received from them, from what they're seeing in their work. The needs of our community that was present at the beginning of the pandemic, such as homelessness, rental assistance, housing, internet access, utility bills, unemployment, is still present now. And so ongoing sustainable funding for both organizations and collaboratives, and also general operations funding to build our capacity as nonprofits in order to serve our communities as best we can, is vital for moving forward. Clear social distancing guidelines and protocols, as well as PPE for nonprofits, is also key. The various safety protocols for direct healthcare providers has required an incredible amount of staffing, equipment, innovation to meet the guidelines, and it has caused budget deficit this past fiscal year and upcoming budget deficits for our healthcare providers in this current fiscal year, actually. Then we're also hearing the need for the easing of the red tape with a lot of the services that are being provided. There are numerous services that are available for our families, but we're hearing from nonprofits that some of them have strict guidelines, and a lot of their clients are not able to access those services. So easing of the red tape somehow will be very helpful to them. I think that's it. I mean, there's a lot more, but those are the main themes that I'd like to touch on today. Thank you, everyone, and thank you for the opportunity.
Thank you so much for sharing that wisdom. And I really want to lift up the staff wellness piece that you mentioned and how critical that is, and the fact that so many of the CBOs are both serving their clients, but also supporting their staff who are also part of the community. So thank you so much for all that wisdom. Now I'm going to turn it over to Kalima from Jefferson High School District.
Hello, my name is Kalima Salahadin. I'm the current president of the Jefferson Union High School District. And I also work in an organization that's just a collection of people of color in different various leadership roles called REACH, which Lisa Teeler is also a member. And so when I was asked to be here today and I heard the second conversation on race and coronavirus, I jumped like, yeah, I'll do it. And then I looked at the panel and I was like, should I be on this panel? Because I'm not a CBO, but in our school board capacity, especially with the students that we've served, we feel like we have to step in at a different level than some of the other school districts in San Mateo County in service to our students and families, and in strong partnership with our community-based organizations, which we've done in the past and had to amplify. So Pacific Islanders Together, working together with them, we have our food distribution, which is 1,200 families get served food every time we have a food distribution. Working together with the Daly City Partnership and with the county, we now are offering testing at our school sites. So these are all happening at our school sites. We had testing at our district office, and now that we have testing at Jefferson High School. The first time we offered testing, we tested over 700 people the first time we offered at our school site. And it continues to be in the hundreds of people that come out every time we have it at the school site, and we send the messages directly from us. So again, what we already know is that many people in our communities are only listening to trusted partners. In our school district, we know we're one of those partners, so we want to be part of that communication process. So my experience during COVID is it's a reinforcement of what I already know. I am very grateful to all of the people that presented earlier from the county. They have been an amazing team to work with. But I will say that the county we need to have a reckoning on how we truly serve all of our citizens in San Mateo County. So we've been having to build that bridge of equity at the same time trying to handle the pandemic. That's a lot. Why are we talking about Wi-Fi for students in the middle of Silicon Valley? Why weren't all our students and all our community members already set up with something that should be seen as a basic and essential need, especially when the first opportunities for testing were housed in Wi-Fi, were housed in access to the internet? We have to stop being treated as people of color as service to everybody else in the county. We have to. So through this entire process, I feel like the outreach has been set up so that we can all get back to work. Even in the school system, there's constant pressure of when are you going to reopen so you can restart the economy, and not that much conversation about is it safe for the teachers, and more importantly, is it safe for the students whose families are those essential workers who we constantly put at risk. I need to understand and feel as a person of color in this county that my health and my wellness is just as important as everybody else's, is just as valued. Because real talk, I feel like if the cases had been disproportionately at this rate in the suburbs in Redwood City, the response would be drastically different. We wouldn't be talking about a lot of the things that we're talking about right now. So when we're talking about recovery and experience and the efforts around recovery, the recovery has to be a recovery for all of us. And we can't continue on this path of where I hear leaders saying, well, it's inevitable that some of us may get it, but we all know who that some of us is. It is not disproportionately spread across the entire county population. It's housed in certain groups. And I don't know if that would be okay if it was any other group where this particular pandemic was housed. So that's the support I need to move forward in my community, to make them feel safe, to continue to get support. One of the things that we talk about in education, because education is not off the hook here, and in the community and the organization that I'm a part of, one of the questions that I ask myself all the time, knowing education's systemic history and of oppression, is that can that same system that's causing the oppression be used to fix it? And I have that same question for the county. Can the same organization that has caught us here be used to get us out. And my hope and faith is in that, and the support I need is to believe that. So I continue to work. I need to believe that my county leaders want us to truly all heal, all of us recover together. So part of that is we need to be part of the conversation, and that was what Reach did. We need to be in the rooms. We need to be part of the conversation. We need to be part of the conversation at the beginning and not after the fact. We need data to show that the services are really helping. I have people in my community who will not get tested because they're afraid of what's going to happen if they test positive, or when they do test positive, they do not answer the phone for the contact tracer because they know it's going to be kicked out of their housing because they live in housing where they're with multiple families, not just one family, but multiple family. And if you're the family that doesn't have COVID, you're going to kick the person who has it out. Or they're going to, if they are a day worker, they're going to lose that nanny position, or they're going to lose that day job because we have become parts and cogs that we just get interchanged. Where can I show them that they'll get the support? Where's the data that I can show them that, look at these people, they've all got help, so you can be confident in getting that help as well? Where there needs to be a bridge, patient navigators that can go out and contact the people on their own. We know that the extra help is needed, but when we talk about the red tape, I know that I'm going to have to go get data to show that they're not showing up. And then we can maybe talk about the patient navigators, the process to get to the things that most community-based organizations who are steeped in these communities already know needs to shorten. That bridge needs to get smaller. So these are the supports we need to, when we're in the rooms, we need to be heard. And when we're heard, action needs to be taken at a faster pace. And I will stop there. Thank you.
Kalima, thank you. I have goosebumps right now. You have really asked some really hard and important questions. I think you're not tracking the chat, but you're getting a lot of shout outs and appreciations for the authentic and very real pieces of information and experience and history that you're dropping here. I think it's really key to lift up the fact that you're pushing us to think about you can't achieve equitable outcomes without an equitable process. And that equitable process requires short timelines between identified issues and action, as well as being part of the conversation from the very beginning. So we thank you for all that you've done to bring the Reach Coalition together and continue to push us on this, and we continue to learn. So thank you. I'd love to turn it over now to Frankie Sapp from the Pride Center to get his take on this experience.
Thank you, Shireen. So for those who don't know me, I am Frankie Sapp, and I'm the program director for the San Mateo County Pride Center. My pronouns are he, his, him. And because there are a lot of folks who don't know me, I will share that I do live with Tourette syndrome. It makes it very interesting to be out in the world and to be talking about and living in a COVID-19 pandemic when you have a throat clearing twitch and you're wearing a mask. It's not the most fun experience. But I also want to thank all the panelists. Sorry, I might mispronounce her name, but Kalima, for what she said, and I'm going to echo a lot of her sentiments and what I'm about to share. So I'm relatively new to my role, and I was only on site for 3 weeks before we went into shelter in place. But when we went into shelter in place, it was we were able to go relatively virtual in less than a week with most of our programs. The clinical program with the therapist took a bit longer because it took more infrastructure to figure out. That made sense. And what we know from the stories we hear, from the clients we serve, from the peer support groups that we hold space for, is that our community, our LGBTQ communities are disproportionately impacted by the pandemic in a number of ways. And for those who don't know, everyone who works at the Pride Center is also LGBTQ. That includes me. So that means that we also are disproportionately impacted by the pandemic as we support our community who's disproportionately impacted by the pandemic. So we are stressed as we support our community. And my team is at capacity. And just even talking with the clinical team, we know from that there's an increase in social anxiety and isolation for those who experience housing insecurity. Shelters don't feel safe in a pandemic. There's a disconnect from peer networks. For older adults, I think a lot of folks on this panel have said and shared there's a lack of access to technology or a lack of knowledge to know how to use it. Youth may be trapped in their homes that don't feel safe or supported. And there's a lot of stigma or denial that same-sex relationships don't experience intimate partner violence, and they may not have the same access to resources to reach out for support. The thing about the LGBTQ communities, and I've said this a number of times, is that we cross race, we cross ethnicities, we cross religions, we cross body abilities and sizes, and we are every demographic. Really, and that's an important part of this discussion, because when we hear, and I was privileged to be on the Vulnerable Populations Committee, and the report did a beautiful job of capturing and talking about the ways that we're going to support people around race and language and abilities. And all of the panelists had mentioned the lack of data, but there is no data being collected whatsoever at all in the county on LGBTQ communities. And we all know I've talked a lot about how the stories we're hearing, but there's no proof. And without the proof, we can't talk about what is needed to support our communities. And the Pride Center is trying to support our communities, but we need to know how. In what ways do you need better support? And in some ways, we know you talk about housing insecurity, job instability. Trans folks, just to take one community in the LGBTQ alphabet, have always been housing insecure and job insecure, and and more likely to be on the street. So you add the pandemic into the mix, and that's just been exacerbated. So with the good fortune and the work, the Pride Center has worked with a medical student at Stanford University, and we have just today launched our own survey to go out into San Mateo County community and survey LGBTQ folks to collect our own data, because we need it. We can't wait anymore. We need to know what is happening to our community, and it's a 5-minute digital survey. We can also provide it on paper for communities in need to figure out how have you been impacted. It's comprehensive as it can be. It's about mental health impact, physical health, housing, unemployment, all of the above, as much as we can. It's a snapshot, but it's a start. because we have to get the resources. We have to prove how we've been impacted. The Pride Center has unfortunately lost some foundation because because money has gone elsewhere, but we need to continue to prioritize LGBTQ people's mental health, because we know our mental health is more compromised than most. So this is what we're focusing on. We had to rely on free labor because our staff is taxed. So we also focus on wellness. We do wellness check-ins with each other. I'm a really good baker. I send cookies and cupcakes and anything I can. I sent out 4 boxes of brownies this week. I know it's not much, but we strive to keep connected, and that's hard when you're on video. But we find ways. We have karaoke parties, and we just find ways to remind each other that we are also our own community within this center, because we have to be holding each other up and together, because nobody expected this to be this long. So we have to help each other get through this, because we're here. We put the community in community centers. We have to support each other to continue to support the community. And I'm not sure how much time I've taken, so maybe I should just.
Thank you so much, Frankie. That was really, really insightful. And I appreciate you lifting up the lack of the data. And here again, showing how community-based organizations continually fill gaps that they identify, that they've been advocating for, and just stretch themselves to find ways. And that's not to condone it at all. It's really just to lift up the leadership of the community-based organizations who just continue to stretch themselves to show up. So thank you. For all of that. I'm going to now turn it over to Georgia Peterson from the Mental Health Association.
Good afternoon, everyone. I am Georgia. I work for Mental Health Association, but more specifically Spring Street. Before diving into a bit of an overview, I just want to take a minute to simply say thank you to this panel, to all of our community partners, and to be quite frank, most importantly, my team. I think one of the things and the common trends that we have heard today is around health and wellness. And I don't know that I could still be here doing this job without my entire team at Mental Health Association. So again, just a quick thank you. I'm coming at this from a little different perspective. So I, in fact, oversee our homeless shelter, and we serve the needs of the severely mentally ill. And barriers, challenges, yes, all of the above are 100% here. Even taking into account our racial inequalities, our economic inequalities, and trying to angle that.
I'm sorry to cut you off, but one of our interpreters is having a hard time hearing you. If you could speak a little bit louder, we want to make sure that this great information you're sharing is accessible to all of our participants.
Absolutely, sorry about that. Again, I think just trying to encompass all of what the world is facing, in addition to a global pandemic, has proven challenging as can be. So one of the things that I think that I really wanted to dive into is not only our homeless shelter, but also our support services. So when the shelter-in-place order originally came through, Mental Health Association immediately switched to having most of our support staff begin working remotely. And the shelter staff, of course, were outfitted with PPE, as we are a 24/7 facility. We initiated extensive cleaning of the shelter, all of our housing sites, all of our offices, and maintained a skeleton crew. Mental Health Association spent a lot of money investing in PPE, working with Human Services Agency to reduce the overall number of clients at the shelter and transitional housing. Additionally, converting 2 of our transitional housing units into isolation or quarantine rooms. Should anyone develop symptoms, test positive, come into contact with anyone who had test positive. We applied for and received funding from the Healthcare for the Homeless, private foundations, the County of San Mateo, and private individuals, which allowed us to provide more meals at the shelter, more PPE for our clients, and to purchase different activities to help just pass the time during a shelter in place. One of our programs is our Friendship Center, and for anyone who's not familiar, it's a social recreational program where individuals can go and get support, activities, etc. And with the pandemic, that unfortunately shifted a lot for many people. And our staff found an ability to use this as a way to increase people's knowledge around technology, including my own. That included remote meetings, phone calls to connect as a group, and even our support staff is making weekly phone calls to all of our members. For some folks, it might even be multiple phone calls, given what level of support they're needing. You know, we have purchased tablets and things of the like, but we are in fact looking to purchase more smartphones and tablets so that we can make more technology available for our members. For our community-based clients, we turned our conference room into a staging area where we prepared weekly bags of essential items, nothing shy of PPE, gloves, masks, sanitizers, Clorox wipes, and I think we can all agree finding Clorox wipes and toilet paper was a nightmare. Food, snacks, activities, and case managers went out to our individuals' homes using physical distancing to ensure clients are wearing the masks as well. And I want to elaborate on the term physical distancing. One of the things that we learned in the shelter was utilizing the term social distancing didn't allow our residents to feel like they could speak. So when we get more around the idea of, you know, 6 feet, 7 feet, 8 feet, 10 feet, and with social solidarity, it made a big difference. Coming back to this, we also have occupational therapists who have worked really hard to create safe distance meetings and activities to, again, keep people engaged. We've used, excuse me, donated funds to put together bags for every case manager to take in the field. And of course, these would include gloves, masks, face shields, hand sanitizer, first aid kits, shoe coverings, seat coverings. And every one of our case managers has been provided a detailed list of testing sites and resources related to COVID. Since we're all clear that this is not over, we continue to need financial support for replacement and ongoing provision of these items, to continue to provide 3 meals a day to reduce the likelihood that residents will be in the community any more than absolutely necessary. Additionally, we have, again, needed to increase our use of technology, adding laptops to every position along with smartphones. These expenses are certainly not included in our past budgets, but as we know today, they are absolutely a necessity. So I think, unfortunately, following the 5 amazing panelists, that is about it for me.
Georgia, thank you so much. So appreciate you just lifting up all the key points and really rounding us out here, because this has been an amazing panel. I can't tell you how important it is for all of us to hear this. And also, I want to just acknowledge that we definitely heard, as a member of the county, I want to acknowledge that we heard critiques of the county, and we heard that. We heard it around the red tape. We heard it around not moving quickly enough. There are a number of things that we are challenged with, and this is why we have forums. We want to be self-reflective. We want to be authentic in our response. And we also know that you're stretched and doing everything you can. And so just appreciate the time you have here. Thank you so much to our esteemed panel. Honestly, can everyone give a virtual snap, round of applause, whatever it is. And we do want to hear from a lot of the other CBOs on this call who also have a lot of wisdom to share. So now I'm going to turn it over to Brenda.
Yeah, thank you so much, Doreen. Yeah, thank you so much, panelists, for being here today, for being part of this conversation. And so much, thank you so much for all the work that you do and for being an advocate for the communities that need our support and advocacy the most. So thank you so much, Lisa, Stephanie, Kava, Kalima, Frankie, and Georgia. So next I'd like to introduce Tanya Perez, who will help us facilitate and moderate the conversation during, I just realized I'm the one sharing, during our open feedback conversation, the challenges and opportunity.
Yeah, thanks, Brenda. My name is Tanya Perez. My pronouns are she, her, hers, and I work at the Office of Diversity and Equity as a community health planner. So we're going to take the next few minutes or so. I think we have about 20-ish minutes or so to take any open feedback, challenges, and opportunities that any of you all have. There is a Q&A button at the bottom of your screen where you can input questions if you so choose to. And I just want to quickly remind you all I just want to quickly remind you all of the Cultural Humility Group Agreements. And you can see them here on the left. A few that I think stand out to me, especially when we do activities like this, is it's okay to respectfully disagree, as well as being disciplined about not making assumptions, and no blaming or shaming. I really enjoyed listening to the panelists speak, and a few things I think that stood out to me. And just in summary, some of the things that we've talked about so far have been finances, of course, staffing, and staffing having to do with needing more staffing, but also, and losing staffing, but also with staff burnout. As we've all heard about Frankie and his baking, and the way that we can take care of each other, and also tangible policy ways that we can also take care of each other, right? As well as the impact on community, volunteers, how data is really critical for CBOs, and the ways that we need to acquire demographic data, as well as PPE. And one of the things that really stood out to me was also Kalima, and the way that she framed everything about her discussion, and how recovery needs to involve all of us, and all of us need to be taken care of, especially as most folks are essential. A lot of our essential workers are the ones that are heavily impacted right now. So I would just want to go ahead and set the tone with that, and open it up for any questions any of you may have, or feedback. What I'm going to do is, if you'll raise your hand, you'll find the raise hand button of your screen. You raise your hand, and we can go ahead and take questions that way. Alrighty, I have a question from Donna Rutherford. So I'm gonna go ahead and unmute you, Donna, okay? Hello, Donna, go ahead.
Thank you. Thank you so much for this panel. This is a very important topic, and I appreciate all of the panelists. My concern is around the homeless population, and it was mentioned that there's not data, but I was just wondering, does anyone have any numbers that they have around the homeless people who have tested positive for COVID in any community? I know that East Palo Alto has, you know, our numbers are off the scale, but does anyone have information around that?
Thanks for your question, Donna. And if we don't have an answer for you, we'll make sure to go ahead and follow up with you when we do acquire an answer. I've just, slight oversight on my part, want to invite people that are on the phone to go ahead and unmute themselves if they also have a question. Alrighty, no questions. So we're gonna go ahead and continue. And we'll check on that answer for you, Honorable Donna Rutherford. Okay, so I'm gonna go on to Janice Matry. So I'm going to go ahead and unmute you. Janice? Okay, so we're going to move on to Jeremy. So I'm going to go ahead and unmute you.
Hello.
Yeah, hello.
Hi, my name is Jeremy. My pronouns are she, her. I live in the Daly City area, and what Kalima had talked about was very important to hear about too. It sounds like, they had taken the initiative to even be on the panel. So my worry is that, while you're saying that we need to listen to everyone, that it's not happening. And they had mentioned there's a lot of services offered at Jefferson School District. Daly City is very segregated, and they're offering it's a main COVID testing site, and they're also doing food delivery or food distribution. And I'm not sure if there was a Wi-Fi involved. I'm just worried. I want to know if there's like any push for other local schools to be doing the same things. And I know Jefferson High School District is mainly comprised of BIPOC students. So I'm just wondering if there's like any type of equitable approach to being that. It sounds like a lot of the work is still on the back of BIPOC students and the BIPOC community.
Thank you, Jeremy, for your great insight. We're going to go ahead and take your question and then see if anyone is able to give you a more direct answer. Okay, so it looks like the next question, we're going to go to the Q&A. And there's a chat question that says that was submitted by Suzanne Moore that Sarija is going to help us answer. And so the question is, I have heard that low income and people of color are resistant to testing because they cannot afford to take time off work. Has there been outreach to inform high risk of support if required to shelter in place? Sarija, would you care to answer?
Good morning, good afternoon, everyone. So we definitely recognize that the folks who don't have paid leave or face significant barriers taking time off work is a population that we need to adjust to best serve. And we do have evening and weekend hours at some community testing sites and have mobilized testing access in other ways to try to reach people for whom getting tested during work hours is prohibitive. We can still use more reinforcement on the messaging and outreach about that supports are available if someone tests positive in terms of economic relief to take the time off to safely isolate if necessary. But taking the time to get tested, the best supports are through the core service agencies and supports like the Immigrant Relief Fund that have been amazing resources to get money in the hands of the people who need it to take care of their own health.
Thank you, Sarija. Okay, it looks like we have, Donna, it looks like there's a response to your question in the chat. I'm just gonna go ahead and read it. It was by Sarija. We've partnered with shelter providers and also supported homeless through our street medicine team in county health. The baseline testing and supports to date have enabled us to address needs, and our epidemiological analyses have not revealed major clusters among our homeless residents, although we know that this is a population that is shouldering many risks. And then it seems as though also Kava will check in with data from the city of Palo Alto. So thank you for that. We have another comment here that says we had very low rates among youth in our residential program for youth who are homeless. and we will make sure to share our data with Healthcare for Homeless for Adults and Youth. So thank you for that. Anybody else have another question? So we see another question in the Q&A if no one else has a live question. Low-income family members providing housing to loved ones living with seriously mental illness were having great difficulty getting their loved ones the treatment they needed to survive safely in the community before COVID-19 in emergency and non-emergency circumstances. COVID-19 placed greater stress on those caregivers and their loved ones. How much longer will the treatment needs of persons living with SMI and their caregivers be ignored? How much longer will the non-intimate domestic violence resulting from untreated SMI be ignored? Okay. So, and I remember also a comment similar to this coming up when we were talking about the recovery initiative and the disparity that was present already with folks that were living with SMI pre-COVID. So this is something that we're definitely going to be thinking about and working with as we think of recovery. So thank you for this comment. Another comment is that Second Harvest has resources for food as well as some sanitation supplies and infrastructure for CBOs. Please reach out if you have any needs. All right, so in the next couple of minutes, I also want to give the opportunity to CBOs to go ahead and answer the questions that we asked the panelists. So what have been some of the challenges and the opportunities while working at a community-based organization? All of this feedback helps us with the implementation of the recovery initiative. It lets us know, where CBOs are coming from and what the needs are. So challenges and opportunities. I think that a lot of the challenges definitely have been around technology and the digital divide, but I think in monitoring contracts with community-based organizations, like Kava was talking about before, opportunities, with the food drop-offs and giving people information about the census and testing and all of these things. These are different types of opportunities that maybe we weren't using before. Technology, for those who have it, some services have become slightly more accessible to them because they don't have to travel, especially folks that are living with disabilities. So there are both. It is a bag of both, challenges and opportunities. So I want to open the floor for other CBOs who were on the panel to talk about some of those things and how they themselves are doing and how their staff are doing.
So this is Frankie. Do you mind if I share?
Not at all, Frankie. Go ahead.
So just as a reminder, I'm with the Pride Center, and just obviously nobody wants to be in this situation whatsoever at all. But one of the challenges we had, being so we're San Mateo County Pride Center. We serve the county, but there were always issues. It was always a barrier with one location. So as you mentioned earlier, transportation was an issue. So either because of lack of access to transportation or lack of money to pay for transportation or car. So with some of our services being virtual, it's increased access to some of our services. And while there's challenges in terms of access to technology or to some people don't like screens, other people would prefer that, right? So there's the comfort of not leaving their home. We're able to serve. I am also physically disabled, so and I also there's just many different ways that we're able. I'm not speaking very eloquently right now because there's so many thoughts going in my head, but we are able to reach outer areas beyond San Mateo City because we're now virtual. We're doing our trainings online, which I think was a goal of San Mateo. So now, once we've gotten through this and we will get through this. I think we'll be able to increase the amount of our services because we'll be able to offer a hybrid model where there's in-person services as well as online virtual services. So we'll be able to reach people who have different preferences and they'll be able to pick and choose.
Thanks, Frankie, for that clarification. And and it's a great spot to talk about opportunities as well and how we can get, being able to reach outside of San Mateo City, I think is a really great achievement. I have another hand up from Carmen. So I'm going to go ahead and unmute you.
Hi, thank you so much. Yeah, I also wanted to discuss, I'm Carmen Harmon, the CEO of Heart and Soul. We're a peer-run organization, and one of the things that we found when COVID hit is that we had to really figure out how we could kind of galvanize our forces with our partner peer agencies. So California Clubhouse was one of those agencies who also brought in Clubhouse from Contra Costa County, Putnam, which allowed us to be able to identify technology early on, very early in the process, that was made affordable by a government program. Subsequently, we are also able to connect with another peer organization, CAVA's organization, One EPA, and just to look at and to brainstorm around how to address the needs of our peer participants, of our program participants through technology, addressing that digital divide, and also to make it affordable. So we were able to access technology, which actually ended up supporting the county's Help at Hand program as well. And then they were even able to broker an even better deal for technology that's in turn supporting us as well. So I think collaboration is so key during this time to just address whether it's food shortage, insecurity, or technology. The other element that really created an opportunity was to be able to address the concerns around Black Lives Matter and racial equity. So we were able to create some opportunities for courageous community conversations with Reverend Chester from One EPA and California Clubhouse, and to really just take that opportunity to stretch beyond comfort zones. It's very easy to talk about, fundraising and access to resources and that type of thing, but it's all also so included in which populations tend to have more access. So we were able to launch a talk series on white privilege, institutional racism, and building allyship. So I think, as COVID has been a source of great loss for many lives and jobs, it's also been such an opportunity for innovation. And for us as a peer-run agency and peer initiative in general has always been kind of a role model for dealing with transition and dealing with opportunities for resilience and thinking outside of the box. And so I'm actually very proud of our peer community in their resilience during these times.
Thank you so much, Cardam. I've heard a lot about the series and how well attended they were. And it really speaks to the collaboration that we're all capable of. And I think you're absolutely right. I think despite all the challenges, there's just been, a reckoning. It's been an awakening, I think, in a lot of ways for a lot of social justice issues for folks that weren't maybe as plugged in before. And you have this desire now from a lot of folks to learn more about what's going on and things like institutional racism. So I'm so happy that all of those initiatives were so successful and that you spoke to collaboration, because much like COVID-19, I think we all can see now how interconnected we are, and how much we need each other, and how much it's important for us to take care of ourselves in order to take care of each other, essentially, and now in a more physical representation of it. So thank you for that. So I see a couple of questions in the chat, but I also see a couple hands raised. So let me go ahead and, Martin Fox, I'm gonna go ahead and unmute you, okay?
Thank you. Yes, I think there's lots of things that collaboration can bring about, and I look at the composition of the sources of collaboration here in the county. We've got over 27,000 veterans in the county, and when COVID-19 came along, it's shut down the Department of Veterans Affairs. It's placed a lot more stress, I think, on the veterans community looking for resources in an area where historically maybe they've gone to the VA. But I also think there's so many veteran services organizations that could help the county with a minimal amount of outreach. I know that the Redwood City American Legion post is going to be hosting a COVID-19 testing event next week. I'm wondering why they're not here, and they're not, we're not using those tremendous resources, especially in the North County, where we know that most of the veterans live. It's really important for them too, because we're seeing the suicide rate in the active military community double and triple. Not that we haven't seen something like that happen. I went to the Domestic Violence Council meeting here last month, and the Keller Center reported a doubling in the suicides here in the county year over year. So there's some real definite needs in that area, and I think we've got some resources, and I would hope that somebody would take a look at drawing the veterans organizations in as supporting the county's needs. Thank you.
Thank you so much for that, Martin. I think you bring incredible awareness to the veterans population. So thank you for sharing all of that amazing information as to what is happening with that community and the impacts that you've seen there. All of this is good for us to know. Looking at the chat a little bit, so taking a little detour into looking at the chat, we have a couple comments that I think are that are good to talk about. So the first one is the digital divide with older adults, and that is something that we have been hearing a lot. They are isolated in places where they used to go, like senior and activity centers are closed. Many don't have the technology or knowledge to use them. If services have gone online, it feels like the population is being left behind, and providers have expressed that the issue of digital divide, that we should be working together, right, to make sure that the older community and the child community both have access to the necessary resources that they have. So that's one. The second one is from Cynthia Eagleton, who's a teacher at San Mateo Adult School, and she sees that students are struggling with various challenges. So first, lack of adequate digital tools. So again, the digital divide. Too much stress in terms of workload, job loss, childcare, housing, a lot of the priorities that we previously talked about. And some have just disappeared altogether. So they've stopped engaging in that form of education and can now be hard to reach as we strive to provide help in terms of offering laptops, hotspots, etc. The consortium, ACCEL, is in the process of administering a survey to find out what support services students use and need. And at the same time, with all schools, they face their own pressures to do testing, show results, and all the usual pressures that school face. However, adult schools are most vulnerable when it comes to funding, and they also serve a lot of very vulnerable communities. So this puts them in a really hard spot. Have to focus a certain amount of time and energy on testing because this ties to funding, even though that's very hard to manage. So thank you for sharing that, Cynthia. It's a really great perspective to have because when we think of schools, a lot of us think of, K through 12 and not really adult school. So I really thank you for that perspective. The next thing, let me check if anybody else has their, Jeremy, did you still have your hand up? Did you have an additional comment? Let me go ahead and unmute you.
I did, but if anyone else had questions, they could definitely go first.
Go for it, Jeremy.
Oh, okay. Oh, so I think housing was one of the issues that is trying to be solved, and I don't know too much about it, but I was just curious about offering the support also to like property owners. And my fear right now is for people who are renting and are already low income and seeing a very well put together PowerPoint, how people were already struggling before. I don't know if there is an intention to support, I guess, property owners. It just it could seem very predatory for them to, I guess, still be like not offering the support to the people who need it the most, I guess, in that way, where like I don't want the focus to be for them to just be like paying for renters to be paying off their own mortgages.
Yeah, thanks for the comment, Jeremy. And it's definitely something that we've talked about in the recovery initiative. And there's different amounts of funding for both renters, so people that need rental assistance, and people that need help paying off their mortgages because they're no longer able to. So small landlords, and that funding is distributed differently. So there's definitely more funding for people that require rental assistance than there is for folks that are currently landlords. But thank you for that perspective as well. All right, let me go ahead and check the Q&A to see if we have any additional questions. So someone submitted a question that said, a lot of the informational flyers for testing sites in SMC have the line, no information shared with ICE. I'm wondering if folks can speak on this as being another issue or as to why vulnerable communities aren't getting tested and how CBOs are responding. So I have a very brief answer to that. That is represented on the flyers because we want to alleviate that barrier with everything going on politically and folks being very careful with using county resources. They wanted to make sure that folks knew that no information would be shared with ICE. That way we alleviate that barrier somewhat. There are still going to be folks that do not want to be tested because they think information will be shared, but as of right now, information is not shared, and I don't think will be shared in the future. So that's why that is on there specifically. All right, and we have 2 minutes left, so I think we have time for one more question. If anybody else has another question that or feedback, or if they work at a CBO and want to say something regarding their experience there during COVID-19. So we'll give it a second.
Tanya, this is Lisa from BHRS.
Hi, Lisa.
Hi, thank you. You're doing a great job. I just wanted to reiterate, which has already been shared, but I just wanted to make up that point again around the staff of these organizations. And I just wanted to give a shout out to my own organization, those folks who are paid and volunteer, as well as I know for the other CBOs that we are just very grateful for all their hard work and dedication These folks are from the community. They're suffering as well, but they roll up their sleeves each and every day, 24/7, to make sure others are being taken care of, that they're listened to others, that they share resources and information. They are the trusted messengers in our communities. So I just wanted to again thank all of them for their tremendous hard work and dedication through multiple barriers. I mean, COVID has been a domino effect on a lot of different fronts. Just not sort of the obvious things that we see kind of on the surface, but also just underneath all the things that happen that are not spoken about or people just deal with and just keep moving. So I just wanted to make that acknowledgement.
Thanks, Lisa. And so with that, I think it's time. Thank you so much for all of you that participated. We really loved hearing from all of you. If you had a question that we weren't able to answer on the spot, we will be following up about the answers of those questions, but thank you for raising them. I appreciate all of the feedback that was given for various communities, and then all of our panelists that were here. The spirit of collaboration definitely permeates this event, and we're really happy to be in community with all of you, because as Lisa said, CBOs are the trusted messengers, and so the stronger our collaborations are between county and community-based organizations, the stronger our communities will be. So thank you so much for everyone that participated. And so now I'll hand it back over to Maria.
Yeah, hi again. I am truly honored to welcome our Deputy Chief of San Mateo County Health. Sarija has more than 20 years experience in health policy and community health issues, and has served in senior roles in the nonprofit, the public, and philanthropic sectors. She has also been an amazing inspiration and support in all of our racial equity work, and we are happy to have her here today.
Hi, everyone. And for those of you who I haven't met, I'm Sarija Srinivasan, and I go by the pronouns she and her. And I just want to close this time together first with gratitude. Gratitude for your time, gratitude for your wisdom, gratitude for your leadership on so many fronts. In this month of gratitude in many cultures, in the Indian American culture that I'm a part of, this is also a festival season of Diwali in which we reflect on good defeating evil and light overcoming darkness. And being in our Zoom room with you all, I feel that light from the ways you've persevered, the ways you've become healers for your own teams and staffs and their wellness, and also for the ways you're amplifying the voices that don't get heard as much as they should and as systematically as they are needed for us to truly become the equitable community we need to be and we're reckoning with, and we're not there yet. I want you also to know, as someone who's participated in all three of the forums and had the privilege to learn from so many of you over many years, that you're heard. And as a leader within the county health team, on behalf of Louise Rogers, Chief of Health, who was really sorry to miss today, and my colleagues, we hear our weaknesses. And you know, we're committed to doing better by each of you, the organizations you are guiding, and the people whom you are serving. And many of your areas of emphasis and advocacy passed in the last 11 months have driven us to get better at mobilizing more testing, removing barriers, and streamlining. We're not as fast as we need to be from what we're hearing today, but please know you're heard and that your voice really matters, and that we hear this as dialogue and advocacy that's necessary but not sufficient until you continue to see action and accountability from us, which we're striving to keep doing better every day. This is a challenging period in the pandemic as well. And if we can hang together in solidarity and protect ourselves and each other in these weeks in which physical togetherness was the norm, and maybe gathering and traveling was a norm, if we can get through these weeks with the love and support you're showing in the chat and in your comments and in your advocacy, we'll do better in the light that's ahead. There are safe vaccines on the horizon, and we'll come back to you with more information on those fronts to involve you early in that planning. I want to really appreciate the courage and wisdom of our panelists, and I want to really honor and acknowledge all of the time you spent, and hope that you know that it's received, and we look forward to following up with you.
Thank you so much, Sarija, for your words, for being here today, and to everyone, to our panelists, attendees, and everyone that made this event possible. We really want to thank you. We're going to finish with a grounding exercise, so I would now like to welcome back Cindy Donnis, who is a licensed marriage and family therapist and oversees our trauma-informed training program, also known as a neurosequential model of therapeutics. So we're very excited to have her back to provide us with a wellness exercise as we close. And we will have a short poll at the end, so if you can stick around, that would be wonderful. Welcome, Cindy.
Thank you. Thank you, everyone, for being here. I'm very grateful that we have a little bit of wellness at the end to wrap this up. And something that has been at the forefront of my mind in the last 2 weeks, especially with all the stress, last week was the setting intentions for ourselves. And before we set that intention, I want to read something, because I think we often forget about who we are in our community. I think we remember who we are in our work, but it's important to remember who we are as a family member, as a loved one. And here's a quote: "Whatever you do, be gentle with yourself. You don't just live in this world or your home or your skin. You also live in someone's eyes." And I think we owe it to ourselves and to our loved ones to be as healthy as we can possibly be during this pandemic, during tumultuous political times, and that we are present for others. So with that, I just want us to take some moments to take a deep breath in and release it. And notice your physical state right now. Notice your needs. Are you hungry, thirsty, tired? And just take a few moments to check in with yourself. Notice where you're holding tension right now. Notice perhaps where you're holding a specific feeling. And be present with all of that. And while you sit there and notice your feelings and notice the needs that are coming up for you, set an intention for yourself for the coming days of what it is that you really need. Perhaps you need more movement. Perhaps you need better sleep. Perhaps you need more reflective moments. And either through prayers, through thoughts, through putting the energy out, go ahead and set that intention out in your surroundings so that you're open to receiving cues from your environment, from your loved ones, to get your need met. Let's close with just a few sensory experiences of your environment. I want you to notice at least 2 sounds. I want you to notice the temperature in your room. Notice where your body and the chair that you're sitting in make contact. And I want you to pick a color and go ahead and just look in your surroundings and see how many objects of that color can you find. Take in one last deep breath and hold it for 4 seconds. And release. Try to get a little bit of movement going on in your shoulders. You've been sitting for some time, in your neck and in your head. And I hope that that intention that you set comes back to you. Thank you.
Thank you, Cindy. Thank you so much. And to wrap up, we're going to launch a very quick poll for those that are still in the room. If you can take time to complete it, just to let us know how today was for you. In our next slide, we just want to make sure that you have our email address so that you can continue to stay in touch with us with your feedback, as well as our mailing list. And then finally, I'm going to turn it over to Brenda to close us out.
Thank you, Francis. Cindy, thank you so much for leading us through that grounding exercise. It's really a wonderful way to end the event today. Yeah, and we want to extend an invitation to all of you to join us for our Diversity and Equity monthly meetings. We meet on every first Friday of the month from 11 a.m. to 12:30. Currently, all meetings are virtual. You can have, and you can see the meeting information online, and you can also reach out to us through the OAT email address, and we can add you to the list.
Thank you. More information will be sent after the meeting. We will try to get to all the Q&A questions that we weren't able to answer today. But thank you so much. We hope that you all have a wonderful weekend. Thank you for joining us today.
Thank you.